Welcome back everyone. I hope you've had an amazing week. I'm Dr. Daniel Follows and this is GP Made Easy. So for today's video I'm going to cover ear infections, in particular inner ear infections, or more commonly known otitis media, and outer ear infections known as otitis externa. But before I do, don't forget to like, comment and subscribe so I know that you're enjoying this content. But anyway, let's get on with the video. So first things first, before we dive into the video, I've got up here, just on either side of me, just some pictures of the outer ear anatomy and the inner ear anatomy. So it'll help you understand some of the terms used later on in this video. So just take a little bit of time to have a look and familiarise yourself with some of the key terms. Now let's dive into otitis media. So what is otitis media? Well, its definition is inflammation of the inner ear associated with an effusion and a rapid onset of symptoms. And it becomes classed as recurrent otitis media if you've had 3 or more episodes in the last 6 months or 4 or more episodes in the last year. It's caused by both viruses and bacteria, and it's sort of similar viruses and bacteria that I covered in one of my previous videos on sinusitis, which I'll put the link up here so you can go and watch that video if you like. Otitis media is more common in children and most common from birth to 4 years of age. Otitis media is mostly a self-limiting illness as well, and about 60% of people will make a full recovery without any need for antibiotics. So, what are the symptoms of otitis media? Well, people may present with earache, they may be tugging at their ear, especially in children, and they'll have some of the symptoms of general illnesses where they'll have a temperature, off their food, feeling a bit tired. And then the next step for assessing them is to have a look in their ear with the otoscope, which I've got one right up here on the shelf. And things that you may see include that the tympanic membrane may look red or yellow or cloudy. There'll be fluid behind the tympanic membrane, and sometimes you may see a perforation. So up here I've included some pictures of what you might see on otoscopy exam as well. Also in these patients, don't forget to examine the mastoid by pressing the bone behind the head. So if there's signs of mastoiditis, you'll need to have a chat with the ear, nose and throat team at the hospital. So how do we manage otitis media? Well, for the majority of patients, you just advise them to take regular pain relief and reassure them that the symptoms will settle in 3 days to 1 week. The guidelines recommend to give antibiotics to patients who are systemically unwell, who have signs of a more serious illness, or if they have an increased risk of complications, for example, immunocompromised patients or elderly patients. So, which antibiotics do we give? Well, the first line we tend to give is amoxicillin, or if they're penicillin allergic, then we tend to give clarithromycin or erythromycin. If they deteriorate on these antibiotics, then the next step is to give them co-amoxiclav if they're able to, or if they can't, then it will be having a discussion with the microbiologist. In some cases, if you don't think the patient needs antibiotics, and if the family or parents aren't happy with your plan, then what you can do is issue a backup course of antibiotics and give patients clear instructions what to look out for when they need to go pick them up. And anyone who's having recurrent otitis media, then they need referring to the ear, nose and throat team, as they may need insertion of grommets. And this is what they look like on otoscopy exam. Now, moving on to otitis externa. This is defined as diffuse inflammation of the skin and subdermis of the external ear canal, and it can involve the pinna or the tympanic membrane, and it's defined as chronic otitis externa if they've had symptoms for over 3 months. Risk factors for developing otitis externa include skin conditions such as eczema, Acute otitis media, as if the tympanic membrane pops and the fluid drains, that could then infect the external ear canal. Contact dermatitis, trauma, any foreign body, hearing aids, or water exposure. So the symptoms they may present with is ear pain, itching, and discharge. So the signs you'll see is tenderness to the tragus and or pinna. When you look in the ear with an otoscope, the ear canal will look red. There can be discharge in that canal as well, and it may look edematous or inflamed. The tympanic membrane may also look erythematous as well, or you may also notice cellulitis around the ear as well. Please also be aware of a condition called malignant otitis externa, which is when examining them, their pain feels very disproportionate to how they should be. Malignant otitis externa is a serious condition, and if you suspect it, you need to be discussing with the ear, nose and throat team at the hospital, as they will most likely need admitting. So, how do we manage otitis externa? First of all, if the patient does any water sports, it's advised for them to avoid doing it for 7 to 10 days. Or if they can't avoid it, then to use some ear protection to stop water getting into the ear. The next line is patients can get over-the-counter 2% acetic acid drops. Commonest one I've heard people get is one called Ear Calm, and they use that for about 7 days. It's recommended that they apply it morning and evening and after they go swimming. It is also recommended that they can dry swab any secretions, and what I would recommend is to just use the corner of a flannel to just lightly dab the ear. Please be advised not to recommend them to use cotton buds, as that increases risk of perforation. If the over-the-counter treatment hasn't worked, then the next step is recommended to give them a 7 to 14 day course of topical antibiotic, and I'll show you the different preparations shortly. You can also add in a topical steroid if there's signs of severe inflammation, quite bad erythema, or if there is edema in the canal. It is recommended instead of topical antibiotics to give oral antibiotics to anyone who is immunocompromised, if they have signs of severe ear infection, or if the infection is spread beyond the ear canal. If someone's having recurrent or chronic otitis externa, then it's recommended first of all to get an ear swab to see if there are any alternative treatments you can try, and if it is still being persistent, then the next step is to refer them on to the ear, nose and throat team, where they will need what's called an oral toilet, which is essentially washing out the ear. So up here I've got the table of all the topical preparations, from topical antibiotics to topical antibiotics with steroids, and with some of them I've got the brand name in brackets as well if you're trying to search for it on your computer system. Please be advised, if you do notice a perforation on examination, it is recommended to avoid any preparations with aminoglycoside antibiotics in them. Well, that's it for today's video. I hope you found it helpful and learned something new. Don't forget to like, comment and subscribe so I know that you're enjoying this content, and I'll keep making more for you. And also, if there are any topics you'd like me to cover, then please comment down below and I will cover them in future videos. I'm also on Instagram, so check me out on there as well. It's just up here and it's the same name, GP Made Easy. Or if you would prefer, you can contact me by email as well, and that's just up to this side of me as well. Well, I hope you guys have an amazing week, and I will see you in the next video.